so I've got, I can't even read this. I have D. Steph. He's not here. Who's that next? What's that say? I can't read the next. Whoever the next one. I can't.
Pillion's there. Mason, Emmons.
Oh, Obin, he's not here. Okay, Pillion.
All right.
It looks like Senate Bill 1538.
That's correct.
Okay, what do we got here?
There is an amendment.
Okay, we have an amendment in the nature of the substitute. Someone move the amendment. I'll do it. Second, Barker. All in favor, say aye. Aye. Okay.
Rolling. Okay, the amendment adds clarifying language suggested by DMAS to make it agreeable to all parties. So, as amendment, Senate Bill 1538 requires DMAS to provide reimbursement when the services provided for the state plan are provided by a pharmacist, pharmacy tech, or pharmacy intern. This is a simple fix to ensure Medicaid will reimburse pharmacists while working within their current scope of practice. It does not expand any of their scope. Currently, pharmacists are authorized to provide a variety of services, but Medicaid does not reimburse them for these services. That's the bill.
Okay, I'm looking for where the new tech, okay. Okay, so this provides for the reimbursement of pharmacy techs, and pharmacy interns.
That's correct.
And is this
Through DMAS.
through DMAS? They weren't getting paid before?
That's my understanding. I think somebody here is
Okay,
here.
anyone here to testify? Come forward.
Hello, Mr. Chair, members of the committee.
I gotta go to 3 other places.
All right. Suderline, can I vote you as the right-wing radical that you are?
He would like this
Just
one.
keep me for quorum.
Okay, all right, I'm just gonna abstain you on
But
it.
it's just not, it's not possible.
I gave vote yes on this. Okay, all right.
Billion yes for them.
Okay.
Oh, here's Donovan right here.
Siobhan's here.
Sorry, I apologize.
She has my proxy.
You got Suderline's proxy, okay.
Thank you.
Okay, yes, ma'am, please speak.
So, this bill would allow Medicaid to reimburse pharmacists for clinical services. Currently, it's not happening, and this committee is very familiar with the modernization of scope of practice, that services that patients are receiving at pharmacies, and so this is gonna allow the Medicaid population to take advantage of those, additional services.
Okay, anyone else want to testify on 1538? Okay, do I have a motion?
Move to
All right.
recommend reporting.
Motion and second to recommend reporting. All in favor, say aye. Aye. Any opposed? Suderline's an aye.
Aye.
There you go. Okay.
I have another one, but it's Senate Bill 1416. But it looks like we have reached an agreement with the parties, and I'm asking to strike that.
1416.
That's the agreement.
That's the agreement. Good drafting something. 1416.
Amendment of death certificates. Okay, we're going to kill that. Okay.
So moved.
Okay, we're striking. Motion.
Request of patron.
Motion to strike at the request of a patron. All in favor, say aye. Aye. Okay, stricken.
Thank you, Mr. Chairman.
All right, a little bit of housekeeping. I've got an identical bill. Senator Reeves asked me to roll Senate Bill 1203 into Senate Bill 791. I'll take a motion on that.
So moved.
Second, all in favor say aye. Aye. So 1203 is merged into 791, and then Senator Hashmi asked me to PBI with a letter, Senate Bill 1432, and that letter should go to Joint Commission on Health Care. So I'll take a motion and then get a second.
moved.
Okay, and motion and second. All in favor, say aye. Aye.
Aye.
So we
And
PBI 1432 with a letter to Joint Commission on Health Care. Okay, next on the hit parade, Peak.
Have you already done that?
Which one?
Already do two?
Well, they weren't here.
They were here, okay, just checking. One.
I've got 960, 972, and 1132.
All right, let's go with 1132 first, if we may, and I believe
Sure.
I've got a substitute. I think
So
11.
moved. Who's the substitute?
Okay, distribute the substitute, please.
Is that my 1132? Yes. And this
Thank you.
Mr. Chair, members of the committee, it's a pretty simple change. What has happened, we found out, sometimes when they've had to transport people through the behavioral BHDS, they've been picked up and they're taking them to a facility. They might be held for mental evaluation. They're not able to do a criminal check. BHDS, the facilities don't think they have the authority to do the criminal check, and this language allows them to do that. And it's for safety, so they pick them up. BHDS doesn't think they're covered under it, and so this language allows them to do it. And so we need to adopt that substitute, and I have somebody to speak.
Okay, I think we've adopted the substitute. The question is, yeah, do you have a witness?
I believe I do.
Come forward. If there's a witness, yes, ma'am.
Good afternoon, Mr. Chairman, members of the subcommittee. I'm Leah Mills. I'm Deputy Secretary of Health and Human Resources. Thank you to Senator Peak for introducing this legislation on behalf of the administration. We urge you to report or support Senate Bill 1132. That would clarify existing language that the Virginia State Police can disseminate criminal history information to our Department of Behavioral Health and Developmental Services and ensure our state hospital facility staff and receive the criminal histories on individuals admitted for forensic evaluations. This is only for individuals admitted for forensic evaluations. Currently, our census has 60% of our individuals are admitted for forensic evaluations. We've had about 103% increase since 2012, and this would just clarify the code. So just to give you all an example, sometimes when we receive admissions that are court-ordered, we might have an individual that is receiving an evaluation for a drug possession charge, but our staff may not realize that they might have pending in another jurisdiction, like dangerous behaviors or a pending murder charge, so this would be a tool for them. So
Okay.
we urge you to support this.
Okay. Anyone else here to testify on Senate Bill 1132? Basically has to do with use of
Criminal
criminal
check,
history.
yeah,
criminal-
when
criminal
they're
background check.
taking us.
Question, Mr.
Yes, Senator
What's the difference
Donovan.
in the substitute? I've seen the substitute.
I could not understand that either. Why do you know what the difference in the substitute was?
yes, Senator
I didn't get it
So-
until I walked in.
Accidentally,
Yes.
when the bill was drafted, it was a little more encompassing and included those that were civilly committed, and so the substitute makes it clear that it's only for the forensic patients.
Thank you.
Okay, great.
Move to recommend reporting.
All right, we have a motion, a second, recommend reporting. All in favor, say aye. Aye. All right, it's through. Okay, what else you got?
Senate Bill 972, I think this y'all will deal with as equally as quickly and efficiently. This is talking about vaccines and mandating and strengthening the religious exemption.
Okay, hold on, 792 is Chase.
No, 972.
972.
972. It comes under the Immunization Act, and it just, on lines 80 and 81, currently under lines 79, 80, 81, the department can make you take the vaccine if there's an emergency or epidemic's been declared, and this bill strikes that so that no one can be made to take the vaccine, no matter what circumstances have been declared by the board, Department of Health,
Okay,
If they have a religion.
for religious
let me just
exemption
read this, nothing.
or medical exemption. This is just strengthening the religious exemption to vaccines.
Okay, all right. Seems pretty self-evident. Anyone here to testify in favor or opposed?
Move to recommend.
Well, let me, I got a witness back here.
Sorry, it's too fast.
Yep, go ahead.
Very efficient.
I'm Dr. Barbara Sadler, a Virginia physician and scientific researcher, and I'm representing the Virginia Medical Freedom Alliance here in strong support of this bill.
Okay,
It strengthens the durability of the religious exemption to be as equal to the medical exemption. In other words, it doesn't go away. The basis of it, the strongly held, sincere religious beliefs or First Amendment right to practice your religion when an epidemic is declared. It also prevents unelected administrators, such as the Board of Health and the State Health Commissioner, from mandating vaccines.
okay. All right, thank you. Anyone else to testify? For or against? All right.
Move to recommend reporting.
Okay, I have a motion and a second. All right, all in favor say aye.
Including Suderline.
Okay, all right, that bill passes.
Goodness
What else you got?
gracious. Well, we're on a roll. Let's get to the third one. This one's going to be really simple, I think. Senate Bill 960. This, and I've got an amendment.
Got an amendment.
So this is to prohibit surgical procedures to perform transgender changes under individuals 21 or younger. I struck it. My original bill had talked about hormones and drugs and all of those things. The amended version is meant to apply only to surgical procedures, so that we cannot have, at any of our hospitals, our doctors cannot do gender transition procedures that remove body parts of individuals who are under 21. And so in doing this, there was a lot of information, and just in general, I've seen it from children who were appearing on the news who had under the age of 18, it had gotten the reassignment surgeries, had body parts removed, and then later on in adulthood regretted the decision. Vanderbilt recently just changed their policy to not do surgical procedures on 18 and under, I believe. I don't know if they went to 21 or not. And so based on some things that have been out there in the news, I brought this, but I think the hormone treatment, there's some question as to whether or not it is actually irreversible. And so we'll take a look at that later on. But I think right now, as a general policy, you can't buy alcohol until you're 21. You can't buy tobacco till you're 21. You cannot get a tattoo before you're 18. You can't get your ears pierced without the permission of your parent before you're 18.
Huh.
And so I think
My son got his ears pierced.
he shouldn't have.
He was 16.
Yeah. Did you approve?
Hell no.
Did your mother approve? Yeah.
What could I do?
My wife did, but her sister took her
Right,
to get it.
right.
So, but tattoos, all these things you cannot do, and they're not nearly as permanent and irreversible and perhaps damaging down the road if someone has a change of feelings.
Okay, all right. I think it's self-evident what you're doing. Let me ask
So
a
it's
question.
just surgeries, yes.
And I know I've got a doctor next to me. If you have a child under the age of 18, don't you have to have parental consent for any surgery? I mean, that's current law, or else it's a battery.
Correct.
Okay, all right.
So now a parent can't, this would not allow,
This
a
is, so a
parent
parent even could not.
can't consent before 21
Okay, all
unless
right.
it
What
does.
about parental rights?
Parental rights can't got to protect the children, and I will say it does allow, in the case of childbirth where there are mixed chromosomes, things like that, does not prevent that, and it does not prevent health care, emergency health care.
All right, so this is Senate Bill 960, basically prevents what I would call gender transformative
Surgeries.
under the age of 21.
Yes.
Okay, I have a feeling someone's going to have an opinion on this. Witnesses, James, come forward.
Mr. Chairman, let me get that on. Mr. Chairman, so there's two vehicles, I think two different bills here
Okay.
that are a little bit different.
Okay.
Slightly.
This is 960.
Is it permissible for me to just speak to both of them? Because
Sure, just introduce yourself, your
Sure.
group, and then just go to it.
Sure. So I'm Todd Gacky on behalf
Todd,
of the
I'm sorry.
Family Foundation.
Yep, got you mixed up, okay.
And so let me begin with a statement from the American College of Pediatrics. There is not a single long-term study to demonstrate the safety or efficacy of puberty blockers, cross-sex hormones, and surgeries for transgender-believing youth. Puberty blockers may actually cause depression and other emotional disturbances related to suicide. In fact, the package insert for Lupron, the #1 prescribed puberty blocker in America, lists emotional instability as a side effect and warns prescribers to monitor for development or worsening psychiatric symptoms during treatment. Every child deserves a normal childhood that allows them to experience puberty and other normal changes throughout their life and deciding who, and how they become. And a child who experiences gender dysphoria and identifies as opposite sex certainly deserves compassionate help. They deserve counseling. They deserve professional assistance to help them navigate these difficult challenges. But what they should not be pushed into in experimental procedures that could leave them permanently scarred, sterile, marred for life. And I think that the courts have also kind of weighed in on this as well. Sable versus Communications versus FCC. There is a compelling interest in protecting the physical and psychological well-being of minors. Bellotti versus Baird. During the formative years of childhood and adolescence, minors lack the experience, perspective, and judgment to recognize and avoid choices that could be detrimental to them. And then Gonzalez v. Carhart says that a significant role to play in regulating the medical profession and that the state's authority to regulate the medical field is even stronger in areas where there is medical and scientific uncertainty. So I think these bills address the interest of protecting the minors while trying to ensure that they have avenues to seek counseling and other help and assistance, but not endangering their lives, not endangering their well-being and being scarred from what are essentially experimental drugs at this point. So with that, I would hope that you would support this measure as well as Senate Bill 791 as well.
Okay, all right, so we have 960 in front of us, 791, just,
I think that's the one we just rolled into.
okay. All right, well, let's take 960, okay. Yes, ma'am.
Harris Mitchell, Virginia Catholic Conference, we also support the bills.
Okay, thank you. Okay, opponents of the bill. Yes, ma'am.
Yes. Good afternoon, Narissa Rahman, Executive Director at Equality Virginia. There's been a swath of anti-LGBTQ legislation that's been proposed attempting to block transgender young people's access to age-appropriate, gender-affirming health care. While these bills all differ slightly, but they're all focused on stripping affirming medical care away from young people in Virginia and interfering with the medical decisions made between patients, their family members, and their medical providers. No one should face discrimination because of who they are, and everyone should be able to access quality-affirming health care in their hometown. This age-appropriate, gender-affirming care is safe, medically necessary, and supported by every major professional medical association. Discriminatory legislation runs counter to the growing consensus in the medical community that treating trans young people with affirmation and respect is a central means of providing their health outcomes. Major medical associations, including the American Medical Association, the American Academy of Pediatrics, and the American Academy of Family Medicine, recognize that supporting trans youth is critical to their health and well-being. Patients and their healthcare providers, not politicians, should decide what medical care is in the best interest of a patient. These are deeply personal and individual decisions that should be left to families to make at home or with their doctors. We ask you to oppose these bills. Thank you.
Okay, thank you very much. Next, and if you agree with the previous speaker, just give your name, who you represent, and
Mr. Chair, members of the subcommittee, my name is Wyatt Rolla. I'm here on behalf of the ACLU of Virginia. We oppose SB 960. As the previous speaker mentioned, all three of these bills would bar healthcare professionals from, all three of the bills you'll hear today will bar healthcare professionals from providing transgender youth medically necessary care. I will be brief, but I just wanted to, since the speaker in support spoke on the legal issues, just wanted to offer two of the myriad of issues that the ACLU sees with these bills. First, these bills would violate current federal prohibitions against discrimination on the basis of sex. That is still true with the substitute that narrows this to surgical procedures. Under SB 960, the same medical treatments that are prohibited when provided to transgender adolescents to help align their bodies with their gender identity may be provided to non-transgender adolescents patients to help align their bodies with their gender identity or for any other purpose. By banning certain forms of medical care only when provided to transgender Virginians, SB 960 would violate the 14th Amendment of the U.S. Constitution's Equal Protection Clause, which prohibits discrimination on the basis of sex. Further, Virginia's Medicaid program is jointly state and federally funded. The bill's prohibition on the use of state funds for these healthcare services would also violate Section 1557 of the Patient Protection and Affordable Care Act, which protects the right of individuals to access health programs and activities of recipients of federal financial assistance without facing discrimination on the basis of sex. finally, again, to be brief, just to cite some legal decisions, Brant v. Routledge in Arkansas issued a preliminary injunction blocking Arkansas's ban on gender-affirming care, finding that the plaintiffs were likely to succeed on their equal protection claims. That was upheld by the Eighth Circuit. Eknes and Tucker v. Marshall preliminarily enjoined Alabama's criminal ban on gender-affirming care, finding that it likely violated the due process rights of parents, as well as the Equal Protection Clause. Boyden v. Conlon found that exclusion of gender transition treatment from insurance coverage likely violated Title VII and the Affordable Care Act, prohibition on sex-based discrimination. I could go on, but the weight of precedent, is certainly points to the fact that these are not enforceable bans.
Very comprehensive in a short time. Yes, and let's move quickly because I got a lot of people here. So thank you.
Hi there, my name is Arthur Newman. I'm here out of frustration over government overreach. This bill would come in between decisions that parents and their doctors should be making for their children and not legislators who don't have any idea what they're talking about. Multiple studies have shown that it reduces, these treatments reduce the rates of suicidal ideation in teens and young adults. And also, these are the same medical procedures that are given to cisgender children with precocious puberty. They already get puberty blockers. It's been proven to be helpful and non-detrimental for years. Sorry, I'm a blue-collar worker. This isn't my job, and it isn't the government's job either. So
Gotcha. All right. Thank you for being here today. Yes, sir.
Hi, my name is Ikshal Bayshore. I apologize if I stutter.
That's all right. Take your time.
I would not be here if this legislation had come out a couple of years ago. I am one of the kids who was on puberty blockers. I have taken Lupron. I took it because I had rupturing ovarian cysts every 2 weeks for 11 years of my life. If you have never had an ovarian cyst, needless to say, they thought I had appendicitis every time it happened. That has since gone away because I've had a hysterectomy. And, yeah. Needless to say, I would not be sitting in front of you if this legislation had gone through. We owe it to our trans kids. We owe it to our fucking kids to... Sorry.
Okay, you're good. Don't use profanity, but you're good, okay? You're doing fine.
We need... I wouldn't be here.
Okay.
I don't know what else to say.
You've done a good job of articulating it, okay?
Like...
Thank you. All right, thank you very much.
Yes.
All right, let me let the next... how many more speakers do we have? Okay, just tell you what, just come up and just say your name, maybe where you're from, and just yay or nay.
My name is Eddie Weirs. I'm living in Richmond, and I oppose this bill.
Great. Thank you, Eddie. Okay, next.
Voices for Virginia's Children. We also oppose this bill and align our comments with Equality Virginia and the ACLU.
Got it. Okay, thank you. Okay, I think we've had a pretty robust debate.
Wrap it up. I tried to really restrict it to those medical procedures that are for gender reassignment, cutting off healthy body parts before 21. And that's
Okay.
all this bill focuses.
All right, I appreciate that. I think someone made the point, and I appreciate the legal background that the lawyer made. I also think that, if it's a minor and the parent agrees to the surgery, I think, that's pretty definitive. And I do believe in parental rights. So I'm going to move to PBI the bill.
Mr. Chairman, can I speak to it?
Of course you can.
Yeah, I have to say, I'm concerned. I think there are examples of times that there have maybe been regrets, but we have to decide if we're going to be parental rights. And if, we can't pick and choose what parents can and can't do. We may not agree with them, but it's just a matter of consistency. And, this is, I think this is a parental right issue as well, and I'm going to have to second the PBI.
I would just point out that it's not parental rights from 18 to 21 because they're an adult, so it'd be the doctor. So it's not parental rights on that issue. Yeah.
All right, I think.
So basically, Senate Bill 1297 is in-person visitation. We had some issues during COVID and learned in the system that where people were had become ill, that their spouses and parents couldn't see those individuals, and sometimes the parents were the next of kin. So one of the examples I'm going to read is from Mary Lipscomb. She's a lifelong resident of Rockbridge County, Virginia. She, of course, supported the bill. In October of 2021, her 44-year-old son developed symptoms of what was called COVID-19. He was divorced, had 2 children, and minors. Because of that, his father and mother were next of kin. His name was Robert Lipscomb. Robert was taken to their local hospital on October 22nd, 2021, then transferred to a larger ICU. Later that evening, he was sedated and put on a ventilator almost immediately. They were never able to converse with him before or during his hospitalization due to the sedating drugs and ventilator treatment. They asked the doctor if they could visit their son. They were told no, hospital policy did not allow that, would not allow in-person visitation. They pushed and pushed, then were able to eventually get FaceTime technology. By that time, when they had a video screen in the room, he had a breathing tube in his mouth. He was still had many IV pumps on, monitoring equipment all around him, and was unresponsive to any words of encouragement. The son never got a chance to appoint his mom and dad or an essential caregiver. As soon as he entered the hospital, he was put on a ventilator and on drugs to basically put him into a coma. At 2 a.m., they were called by the doctor and asked if they would agree to a DNR, do not resuscitate. They were shocked that their son, who just hours before his hospital admission had been responsive, able to answer questions, now is considered seriously ill and dying, and they were called to provide a DNR. Father and I could not visit, could not be in the room to ask him any questions about his care, make decisions. We could not observe that what was taking place. He was in the ICU, of course. His conditions progressed, got worse. Robert's teenage sons were trying to visit him and were barred from visiting him. They could only visit via video stream in which the dad was basically put into a coma and could not respond. On November 12th, they were informed that they could visit their son in person because his prognosis was grim. They filled out the self-screening questionnaires, had to wear a mask in the hospital, and then went to the ICU department. Basically, the next day, they took the children to see their dad, and he passed shortly thereafter. One of the initial reasons I brought this bill up was one of my neighbors who, her and her husband had been married for 57 years, and he had fallen and had a hip injury. And the replacement of the hip injury, when they moved him from, after the surgery, when they moved him from the hospital to an intermediate care facility, he went downhill and kept going downhill. But she wanted to visit him or be with him, and they wouldn't allow it. And in the 57 years of marriage, they had only spent 3 nights away from each other. This went on for 3 months until he passed. So that's the catalyst behind SB 1297, in-person visitation.
I think we get the context, and now I think there's a lot of details here. Do you have witnesses?
We have folks that I believe, well, that witness couldn't be here today.
Right.
We have folks that will be against the bill.
Okay,
So the
you have a witness.
hospitals,
You have, I
nursing
think, a
homes.
friendly witness. Yes, ma'am.
Again,
Great.
Dr. Barbara Zedler, Virginia physician and medical
Come on up,
scientist.
Barbara.
Okay, we got you. Either way.
I'm fine here.
Okay.
I'm speaking on behalf of the Virginia Medical Freedom Alliance. We're in strong support of this much-needed bill. We are shocked by the number of reports just like this that have happened over the past 3 years of the COVID crisis. Hospitalized patients whose rights were stripped away based on sweeping emergency powers granted to government and hospital administrators during a declared public health emergency. There was no personally designated advocate for patients who were vulnerable due to their clinical conditions or for patients who were already vulnerable before their hospitalization or residency in an institution due to their mental or physical condition. There was no one to observe what was going on and assist them in communicating, and complying with their wishes and medical decisions. Patients were subjected to rigid, one-size-fits-all protocols for treatment, despite clearly verbalized or written rejection of or requests for specific treatments. These were ignored. Family or other advocates were unaware because their presence was prohibited. This bill will help prevent these shameful and tragic situations from recurring. In the face of a real, potential, or imaginary emergency, Virginia government should not be overreaching, but rather should be laser focused more on protecting the God-given natural rights of bodily autonomy and constitutional freedoms of each individual equally.
Okay, thank you. Just recognize this is not going to change emergency powers. This is going to go in the code for everyday situations.
Correct.
Right.
And
I know, I'm not, right, okay. Anyone else in favor? Okay, let's hear the other side. I'm shocked, okay.
me too.
Right. Mr. Chairman, Scott Johnson, I'm speaking on behalf of the Virginia Healthcare Association because this bill applies to nursing homes, and then Mr. Rawlins will talk about the hospital application. I want to thank the patron for taking time to meet with us to hear our concerns. I'm going to give you just a 1-2. Number one, in 1987, federal law was passed that governs visitation for nursing home patients. We very much support that. We have to honor that. We have to follow that. It is a right of every patient to do that. Point number two is during COVID, our friends at CMS came out and they've continued to update visitation guidance, but during COVID for a period of time, they basically said, nursing homes, you can't have visitation.
Right.
And so many of our members try to be creative to get an iPad, put a plexiglass. It is not as good as a hug or a kiss or a touch. We get that, but that's what the law said we had to do. So with all due respect to Senator DeSteff's efforts, if this were to pass, you're putting nursing homes in a catch-22 between federal law and what this would do. You had a similar issue come up from Senator Cosgrove on visitation earlier this session that y'all dealt with, and I would respectfully ask that this not go forward.
Okay. Yes, sir.
Mr. Chair, members of the committee, Brent Rawlings for the Virginia Hospital and Healthcare Association, and certainly sympathize with the stories that we're hearing. We heard a lot of that over the last couple of years with COVID-19 pandemic and saw that all firsthand, and took some time to sort through it. Everything that Mr. Johnson said, I can repeat for the hospitals. There's extensive federal regulation, patient rights regarding visitation, whether it's clergy, family, or otherwise, that we have to adhere to. And also just want to point out the work that we've done over the last couple of years to address the visitation needs here in the Commonwealth, including bills in the 2020 session requiring nursing facilities, hospices to establish protocols for patients who receive visits. Senator Kagan's 1356 requiring hospitals to allow protocol visitations for clergy. And I think most importantly, for hearing some of the testimony from the proponents here is the bill we passed in 2021 that deals specifically with designated support persons and caregivers and has some pretty clear guidelines, and VDH has put these in regulations as well regarding the ability of a person with a disability or others to have a designated support person with them in the hospital so that they're not facing these situations alone. So again, just to close it out, federal and state regulation we feel is very extensive in this situation, and we have appropriate protections in place sprinkled throughout the code and hospital regulations, and we think we're well covered in this area. Thank you.
Okay. Yes, ma'am.
Good evening, Dana Parsons, representing Leading Age Virginia Nursing Homes, Hospice, and Assisted Living. I'd like to align my remarks with Mr. Johnson's and also ask that you oppose the measure.
Great,
Thank
okay. All right, anybody else want to be heard on this bill? I think we get it. Here's kind of what, Bill, I'm super sympathetic for what you're trying to do. My mother-in-law was in a nursing home. It was awful. So much of that was being driven by emergency orders, which is a whole nother thing. But I just feel like adding this to the code may be more confusing rather than less confusing.
Mr. Chairman, I agree 100%. I get it. I've read the code. I've talked to the hospitals. I've talked to everyone. But I also, when I had my neighbor who, been married for 57 years, say the last 3 months with my husband, we couldn't touch, we couldn't be next to each other. I couldn't even see him until after he passed.
Okay.
So I get it. I understand that, CMS, what they came down with, said, here's the only reason and the only way you can see somebody. And this is the only way you can visit. And that was not allowed under COVID. Her husband did get last rites
We got
after
that.
he passed.
All right,
So-
we got it. Okay. I'm going to make a motion to PBI and second my own motion. Okay. All in favor, say aye. Aye. I'm voting Barker and Sasslaw. Dave, where are you? PBI. Okay. All right. Thank you. Thank you, Senator. Let me go back up. I think we're on. I got Obenshane, Mason.
Did Mason leave?
Is Monty here?
I think he's next door.
Okay. Why don't Adam? You've been here a little bit. And, you know what, Barbara? You come forward. It's hard because I've got this list, but it's kind of hard to read. Yeah. Whoever's been here the longest, come forward. I'm going to let you. I know people have kind of circulated in and out.
I'll be very quick. Mr. Chairman, I'd ask you to adopt an amendment in the nature of a substitute for Senate Bill 827.
So moved.
So moved.
Okay, I will quickly explain it. This whole bill deals with the requirement to have a safe emergency department in our hospital systems so that there's safety for our staff, our patients, and the families that are in our emergency rooms. So what this bill does essentially is it requires each hospital, and it would require each hospital in the Commonwealth, to submit a security plan for their emergency departments. We would expect the security plan to reflect industry standards. There are associations out there that have standards for security. And the bill also says that they need to have a security guard, a trained security guard or off-duty officer on site for the amount of time that their security plan would suggest they need it. And the security plan would have to evaluate the number of cases, the complexity of the cases, how many psychiatric cases might be coming in the door. I mentioned that they had to be trained. There is an option for a waiver of the security guard requirement on site. I did work extensively with the Virginia Health and Hospital Association, the Emergency Physicians Association, and others who feel that this is a step forward. So I would ask that the bill pass. I might have some speakers here, I'm not sure. Okay. Amy?
Hello, Mr. Chairman, members of the committee. Amy Perrin-Sabert on behalf of the Virginia College of Emergency Physicians. We want to thank the patron as well as the Hospital Association, the Medical Society, and the Nurses Association, who we all work together to come to this compromise. So I think all the emergency physicians and nurses that I know are experiencing a higher level of violence every day in the emergency department, and we think it's really important that we figure out a way to keep them safe. We think this is a fair way to do it, have a security plan as well as a safety assessment, and also have the waiver so that it doesn't have to be at all times. But having a security guard in the emergency department, or a trained security guard or a law enforcement officer, but allowing for a waiver so they don't have to be there at all times. If they determine for the security assessment they only have to be there at certain hours. We appreciate the support of the committee and think this will be a really good step forward for us. Thank you.
Okay. Yes, ma'am.
Elizabeth Hobbs with the Virginia Sheriff's Association, and we also support this bill.
Okay.
Mr. Chairman, Andrew Lamar with the Virginia Nurses Association. Thank the patron for moving this forward and would appreciate your support.
Okay.
Mr. Chairman, Clark Barrow with the Medical Society. We support the bill.
Okay. Anyone opposed to the bill?
That's the question. Move to
Okay.
recommend
All right.
reporting. Thank
Second, we have a motion and a second to report 827. All in favor, say aye.
Aye.
Aye. Sasslaw and Barker and aye. Okay. All right. Thank you very much.
I messed it up. Let's see, it would be Mason,
Yeah.
I think. I added people on.
Okay, you have. Okay, that's okay. We're kind of doing this
Mason
al
and
fresco.
Eben, yeah.
All right, why don't let's do Adam, because he's been sitting here a long time. Okay,
It's fine with me if he goes.
all right, That's fine. Monty, come up.
Such gentlemen.
What a nice guy. Okay.
All right, Mr. Chairman, let's, if it's all right by you, if we could take 1155 first.
Sure.
1155 now has a substitute. This rolled out of here unanimously, got to the floor, third read unanimously, and then we had a little freak out moment that this.
Okay, hold on. I move and second the substitute.
Oh, I beg your pardon.
I move and Barker seconds the substitute be adopted. All in favor, say aye. Aye. Substitute's a force. Go ahead.
So all of it, we wrote in the last bill a segment that says this will have nothing to do with the DOJ settlement, any requirements thereof. It won't, the inspections, et cetera, et cetera, et cetera. And then the commissioner came and said, man, we are so close. We're having weekly, monthly meetings. We're having a conversation at the end of this year. Please don't do anything that could even be considered a problem with the DOJ settlement. And so we yanked it off the floor, brought it back here, because that's the last thing we want to do. And that wasn't at all the intent. This turns it into a Section 1 bill that says, please look at, if you remember the conversations about inspections, here comes DMAS, and they ask for these 25 things. It overlaps with DSS, and 17 of them are the same, but they have 34 things. And then, they're just multiple inspections by multiple groups. And this Section 1 bill asks everybody to get together and determine what are the overlaps, so we make sure that Inspection 1, if there are 15 things on Inspection 2, they transfer. You're good on those 15, right? Let's just not have them. Sometimes they have differing groups in this doing differing inspections at the same time. They don't even know it. And so that's what we were trying to get at. We thought we streamlined it. We thought we avoided the DOJ. And quite frankly, any semblance of putting that in jeopardy or even a cause for concern just isn't worth it. And so this is kind of getting at the same thing, asking, once again, Section 1.
Any opposition?
Okay, any opposition to this bill? We don't need to.
Move to recommend.
Okay, we have a motion, a second, record reporting. All in favor, say aye. Aye. Okay.
All right, Mr.
You're on your way.
Thank you, Mr. Chairman. 1512. Now, this one does plow a little bit of new ground.
Okay.
In the past, we have had our CSBs are overworked, underpaid, under-resourced. We know all that. So I, about 5 years ago, said, man, why don't we let the emergency room doctors do TDOs? And people went, no way, they'll TDO everybody, and we'll, just to get them out of the emergency room. Well, now we know that isn't even helping. That's not the case. So, so what is critically clear here in this bill, if it is to pass, and if you look at line 192 to 204, that's where the bulk, we define certified evaluator. But essentially what we are doing, this is drawn so narrowly, it will apply to one place. Riverside's emergency psychiatric department that they're establishing in Hampton. Okay. And so it will allow certified evaluators there, and you see the requirements in Romanet 1 and 2. And then it says to be employed or contracted by a hospital with a psychiatric emergency department. When they open, they are going to be the only one. All right, so the legislative record must show this is drawn narrowly to only be those people qualified within an emergency psychiatric department. Now, at the end, the enactment clause says, come report all the good things, the numbers that next year they come in here and say, man, this is working so great. We want to do it at the mothership, at our main hospital. No, that's not what we're doing. We're doing it in an emergency psychiatric department only. You see the last enactment clause speaks to the fact that the act expires July 1, 2025. So let's see if it works. Now, with this requirement, they will have to be up to speed and versed in the community-based placement, as well as the certified evaluator will have to see the TDO through to the hearing, okay? And then at the hearing point, depending on what they're placed, if they are in fact placed in a state hospital, at that point, the CSB would take control of the case and the patient. But this just gives emergency psych department the opportunity to do these evaluations in that place, one place, for a limited period of time only. And, Mr. Chairman, that's the bill.
Okay, that's a lot. Okay, who's in favor of this bill? Come forward, 1512.
Going once.
All right, go ahead.
Hi, I'm Stacy Johnson. I'm the hospital president at Riverside Behavioral Health Center. So through this, I have the amazing opportunity to see the build of the first freestanding psychiatric emergency department in Virginia. So our goal through this project is to really develop behavioral health services for our community and for Virginia in totality, while taking some innovative direction on how we can improve. So Senate Bill 1512 is developed to aid in expediting the evaluation of those who are in danger of harm to themselves or others, or in psychiatric crisis, thus unable to make a determination to voluntarily admit. So it would expedite by allowing trained clinicians within the emergency department to be able to complete the temporary detention order or TDO evaluation. So it will reduce wait time not only for patients but also law enforcement, as well as reduce operational redundancies, thus mitigating workforce concerns that there currently are in place. So all decision regarding the actual TDO will still be maintained by the magistrate and the outcome with that. But we're confident that this will really help and improve our behavioral health system, but are putting the sunset clause on it just to confirm that, as well as some reporting strategies.
Okay, all right, thank you. Anyone else in favor?
Good afternoon. My name is Jennifer Wicker. I'm with the Virginia Hospital and Healthcare Association, and we support the legislation. And I've been given permission by Dana Sherrod to say that the Virginia Chiefs of Police also support the legislation.
Okay, helpful. All right,
Elizabeth Holmes, Virginia Sheriff's Association, and we also support the
great.
legislation.
Okay. All right. Anyone opposed? We got more in favor or opposed? You're against. Okay, come forward. Yeah, go ahead.
Good evening, Mr. Chairman, members of the committee. Jennifer Faison. I'm here representing the Virginia Association of Community Services Boards, and we do appreciate the effort to narrowly draw this piece of legislation. However, even as a pilot program, this represents a significant shift in policy. For decades, Virginia has upheld the CSBs as the single point of entry into the publicly funded behavioral health system, keeping a public touch on public dollars. And while this is limited in scope, it does create a disconnect between the evaluation which occurs, the temporary detention, if that is ordered, between that moment and the evidence that needs to be presented once that person is in a state hospital setting, if that's indeed where they go for the commitment hearing. There are some other things that are not included in the Code of Virginia that are required if somebody is going to be able to conduct TDO evaluations. The CSBs are required to go through extensive training, including experiential training, and I'll spare you the details on that, but I have them here. So they have to complete a local orientation in order to be a pre-screener, and we feel like that would be a very important component that is not included in this legislation because it's not codified. Essentially, they have to have an orientation to the documentation, expectations, and requirements, the role and interface with law enforcement. There are 13 of these. One of them is also an orientation to the bed registry. They have to make sure that they understand the local services and supports that are available, the federal laws, and all of these things. More importantly is that there is an experiential piece to this, which requires the completion of 40 hours of observation and of the new employee by a qualified, certified pre-admission screening clinician. And we, in our system, the way that it works is that that's somebody who has extensive experience doing these evaluations. And so those 40 hours are direct observation. And at this point, it's unclear how that would be handled in a system where they don't already have access to pre-admission screeners who are doing those evaluations. In addition to the initial orientation, there are online trainings which could be managed, I'm sure. And whenever the CSB, in order to deliver the experiential training needed, there's no real mechanism to do that. And in addition to those above requirements that fall outside of the Code of Virginia, as you all know, we're moving in a direction with the crisis system transformation to the Crisis Now model, and that does include a new crisis data platform that's connected to the 988 system, and nothing in this bill contemplates how these these certified evaluators would be connected to this system. It also doesn't contemplate how they would be connected to the bed registry, which is supposed to be a part of this system as well. And I don't believe to date that any of the conversations that the Crisis Now or that the crisis work groups that are working on this transition have a mechanism for including these individuals in that bed registry component as well as the crisis data platform. And so the other thing that gives us a little bit of pause is that there's no way to know, there's not clarity on whether the facility would be doing all of its pre-screenings or whether it would just be doing some of them and expecting the CSB to fill in the event that they cannot. There's also a...
Can you like summarize this in a couple sentences?
I can.
You keep going on, it's not helping.
Yeah. So needless to say, there are a lot of things that are not included in the Code of Virginia that are expectations and requirements that need to be assured before something like this could occur. And I'll just sum up by saying, the CSPs have talked extensively about their workforce challenges, and they're real, but we've asked the General Assembly to help us solve those problems in a different way. We've never said that we want to be relieved of our code-mandated services and responsibilities. We've said that we need the resources to ensure that we can continue to do them and continue to do them well.
Okay. All right, anyone else in opposition to this bill? Okay. Yeah, go ahead. Senator Dunn.
I just need to say, we have got to innovate. We cannot solve this problem with transport solutions and have TDOs and security officers in the emergency room and provide the care that we need. I'm really excited. There are a lot of innovations that are bubbling up after we've seen what's happened as a result of COVID. And it's got a sunset clause on here. We have safety checks and balances. I am very excited about this, and I'm going to move that we recommend reporting.
Second.
Okay. We've got a motion and a second to recommend reporting. All in favor, say aye.
Aye.
And I got Sasslaw and Barker, aye. Good work.
Thank you, Mr.
Okay, just so we know, because I got a lot of patrons that have been waiting. Adam, you're next. And then I've got, it's kind of confusing here, but I would have Obenchain, Hanger, Newman, Chase, and Morrissey in that order, okay?
Yeah.
And I apologize. I know, Amanda, you've been in and out, and the problem is kind of the queue's gotten moved around. But let's go with Eben, like I said, and then Obenchain, Hanger, Newman, Chase, and Morrissey. Okay.
Mr. Chairman, I have a substitute for 1546 that's being passed out.
Got it.
And after you hear the circumstances, you may wish to add an emergency clause to the substitute, which is not currently included. Currently, we're in a situation where daycares and private schools cannot get meals catered by private companies, either for new licensure or to remain in compliance. Under current guidance from VDH, the private schools and daycares are being treated as restaurants since they're the ones physically handling the meals to the children. Current VDH policy states that because the private schools are restaurants, the catering companies must be treated like a wholesaler. Sarah Taylor from the City of Alexandria could probably explain the situation a little bit better than I can, but the operative language in the substitute is on lines 54 and 56, 54 and 55.
Sarah? Help us.
Sarah Taylor, City of Alexandria. This was brought to us by a caterer in Northern Virginia who serves daycares and private schools. And right now, the licensure relationship of a VDH restaurant license to a VDH restaurant license has been the standard. And until recently, when the Office of Environmental Health at VDH here in Richmond said, no, the caterer must be a wholesale manufacturing food establishment, which is a VDX license, comes with a lot more hoops to jump through and would really put these caterers in a place where they could not do this job. So right now, the licenses that exist are technically out of compliance, and new licenses cannot be granted because the caterers don't have this VDAX license. So we're just trying to keep these caterers able to be providing, healthy food that is, these licenses grant a level of comfort with regard to food safety. It's not like we're taking away the licensing, and allow them to keep serving these kids in schools and daycares and adult day centers. That's really the solution here. And we worked with VDAX and VDH. We've spoken with the administration. Everyone is comfortable with the way we've done it, and I think we're in a good position as far as.
Okay. Anyone opposed to this bill? Okay.
Move to recommend
Yeah,
reporting.
move to okay.
As amended with the emergency
With an
clause.
emergency
Move the
clause.
Move the amendment.
Okay.
Emergency clause.
Motion is second to add the amendment. All in favor, say aye.
Aye.
We've amended it to add an emergency clause.
Move to recommend
Move-
reporting as
okay.
amended.
All right. All in favor, say aye.
Aye.
Any opposed? I've got Sasslaw and Barker, aye. Okay, you're on your way.
Thank you, members of the committee.
Okay, open chain, Mark.
Mr. Chairman, members of the committee, I will try to be brief. I have 1474 and 1475. 1474 deals with mobile food units, mobile food trucks. And this comes from a couple of local folks out in the Shenandoah Valley. They point out that it is really important to modify the law to allow up to 20% of the food production to take place within 50 feet of the mobile food unit. Right now, for a barbecue truck, for example, you're running the barbecue in many instances in the truck. You can certainly set up a barbecue unit right outside of the truck. It is in such close proximity that it can be inspected. It is otherwise compliant. And right now, my understanding is that the law simply does not permit that.
Doesn't permit what?
The preparation of the
in the
food
truck.
outside of the truck or within the
Oh.
50-foot radius of the truck. So
Not
this
in the
would
commercial kitchen, but not in the truck, but nearby.
this would allow them to extend the tent, set up their sink unit right behind the truck, have their barbecue unit not on the truck, but behind the truck.
Okay, so it's not in the commercial kitchen, it's not in the truck, but it's near the truck?
That's absolutely right. Within 50 feet, still subject to all of the sanitation requirements, inspection requirements, et cetera.
You folks out in Harrisonburg. Okay, all right.
That's my problem. I'm on the wrong bill.
Okay, this is 1474, right?
Okay.
All right, do you have witnesses?
I do not.
That's fine. All right.
There are materials that
I
may
got
have
it.
been
Is there
submitted.
somebody here from Department of Health? VDH? Come forward, please. Yes, ma'am.
Yeah.
Where are you all on this bill?
We have no position on the
That's
bill.
helpful.
You asked if I was here.
Okay, all
I'm
right.
Julie Henderson. I'm the director of the Office of Environmental Health Services.
I mean, okay.
I think this is fine.
All right.
Anyone against?
I mean, is there anyone against this bill?
Move to recommend reporting.
Okay, I mean, y'all are witnesses, no one spoke against this, so I don't know if it's a good idea or a bad idea, but I got no one saying otherwise.
It'll come up if there is, if
Yeah,
it's bad.
believe me,
If it's bad, somebody let us know. Okay, so I've got a motion and a second, recommend reporting, all in favor, say aye.
Aye.
Okay, Barker, Sasslaw, aye. Go ahead.
Now, Mr. Chairman, Senate Bill 1475, this is something right up your alley and my alley.
Okay.
I'm out.
No, you'll appreciate this, but Senator Peterson and I, we have fought some of these same fights. So this is, this is a bill that essentially applies estoppel in certain circumstances to government action. So a health inspector issues a permit. Again, let's use the example of a food truck, okay? Issues a permit to the food truck. There's a new inspector hired after 5 years of continuous, unchanged operation. And then the new inspector comes in and says, this is not compliant. I'm non-renewing your license. Says, wait a second, I worked this out with the old inspector. And I've been operating under the belief that this was compliant. We would have never opened if we hadn't gotten inspected and approved and permitted. This simply says that if the permit has been issued,
right,
if operations are materially unchanged, and the law is materially unchanged if that they cannot come in and non-renew after that period of operation.
Okay.
Mr. Chairman, question.
Go ahead, Senator Donovan.
Unless there's a violation?
Oh, sure. If there are health violations, absolutely. But if it's simply because I don't like the fact that, there are no wheels on the mobile food unit, but you worked it out and, the last inspector approved it and said, that's good. You can't come in and yank the permit, notwithstanding the fact that there have been no changes. If they change it, if they take the wheels off and the new inspector comes in and says, you've done something that takes you out of compliance, they can non-renew it. But they can't come in and say, yeah, old guy made a mistake. You're out.
Okay. I guess I have a couple questions. One is, there's some inspectors or regulators that either are incompetent or lazy or corrupt.
They work for us?
No, but let's say in another state. But permits get issued all the time that, you know what, maybe they should not have been, and there was a mistake, there was a concealed flaw, there was whatever. And I don't want to say that, you get the initial permit and that's, prevents a problem from being remedied. And that would essentially be the case of this bill. You get that initial permit and you're bulletproof.
So, and here's the situation. You've got a small business that has a small business person who has poured all their resources into this business. It has the ability to ruin this family or this small business that has relied on government saying, we approve. So it doesn't relieve them of any of the health obligations, any of the obligations to operate in a manner consistent with the regulations. This goes to the permitting, not compliance. So they can always yank your permit, suspend you, take administrative action because you're doing something that is unsanitary, unhealthy, or otherwise potentially injurious to the general public.
Question, Mr. Chairman?
Senator Donovan.
So, under what circumstances would a permit be revoked once awarded if there weren't a health violation?
So the circumstance that gave rise to this.
No, but I'm saying, negate your circumstances. Why do they have to have renewal of a permit every year anyway?
Oh, that's a very good question, but they do.
Okay. So maybe that's, yeah.
Yeah, I see some issues here. There could be situations where there may be a foodborne illness that becomes manifest and
But that would be a health violation.
That would be a violation. They could come shut you down and issue an order to cease operations immediately if that were the case. This is like every 3 or 4 years you're required to come in and get re-permitted as a food truck.
I understand your position. All right. What do you want to do?
I want to help the small business, but I don't know if this is the right way to do it.
Yeah.
And
here's what I'm going to do. I'm going to give this a gentle PBI. I like the idea, Mark. I'm sympathetic, but I feel like it's a little too broad. There's some other bills coming down the pike. I'm going to be in the same position. So I'm going to give a motion for a gentle PBI, and Saslaw will second me.
And I'm going to at least abstain, if not say no, because I don't know that I fully understand it. But I feel like it's right. I just don't understand why we give permits if it's not to revoke, if there's not criteria.
Okay. All right.
Council has.
No.
I'm gonna vote no to PBI.
All right.
And so Suter line.
All right. So motion to PBI, second. All in favor say aye. 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 Saslaw, aye. Barker,
No,
aye.
no.
2 no. Okay.
Thank you.
You're on your way. Thanks, Mark.
Reverse of the expected result.
Okay. All right.
Thank you.
Sorry. Yeah.
So Open Shane and then Hanger. Emmett, you've been here a long time.
So cheerful.
Mr. Chairman, I'm sure you didn't want me up here because I've been taking your time earlier this afternoon.
That's all right.
All right. All right, Mr. Chairman, I have 3 bills in front of you this morning. I'd like to take 2 of them up first, the ones that deal specifically with CSBs,
Okay.
which is 1169 and then 1465. And I would certainly have to thank, and all of these have been generated rather recently, and thanks to Julia for being able to do this as quickly as she has, turning it around. Mr. Chairman, members of the committee, all 3 of these bills are recommendations of the Behavioral Health Commission, and I was the lucky one that got the straw to present them to you, thinking, well, this is a piece of cake because I got a full commission behind me and no problem. And so the two bills that I singled out to go first with on CSB performance, primarily looking at the CSBs, these bills were generated in response to a JLARC study. And JLARC has been involved with this from the get-go as we developed these in the Behavioral Health Commission. And then over this past week, as last week you recall, they were on your docket, and I had them pass by for the day because we had generated some concern within the administrations in Department of Behavioral Health. And so we've been addressing that this week, and I believe the substitutes that you have in front of you do that, and I've got lifelines here, I hope, if they haven't left the room yet. Certainly Drew Dickinson, who has worked this thing and has been being negotiated today, is here from JLARC.
Okay.
As well as we've got the folks from the Behavioral Health Commission, specifically Natalie, and there are people here from the CSBs as well, as you've heard, you know Jennifer well. The intent, as you all know, that the CSBs are the single point of entry for access to public behavioral health services here in the Commonwealth. And back during the McAuliffe administration, working with the Secretary of Health then, I carried the legislation for STEP Virginia, which is intended to create the possibility, not just possibility, that certainty that services would be provided timely and equally across the Commonwealth. But with 40 CSBs, that's a difficult task to pull off because, as someone observed last week to me, and I'm sure you've heard this before, you've seen one CSB, you've seen one CSB. They do contract work, obviously, from the Department of Health, and both of these bills, to varying degrees, address the contract itself and what's constituted in that. The first one, 1169, one of the provisions that was calling for some specific changes, there's an enactment clause in the substitute that would delay implementation of those particular clauses in certain sections there, 508 and 608 of subsection C for till 2025, I believe is the trigger date. My point being, the full commission unanimously endorsed these bills. There was concern with the administration, and basically within these two, working with behavioral health, we've sorted that out over the last couple of days, including this afternoon.
Okay.
And there are people who can, if you want to, there are a lot of details in here as far as provisions particularly in 1169. In 1465, it gets into actually more adequately defining what is the mission of CSBs, and that's incorporated in there as well.
But which one?
1465. Yes, I'm sorry.
Mr. Chairman.
Yeah, I would like for y'all to adopt the substitute on
a second second and a motion to adopt the substitute. All in favor, say aye. Aye.
Aye. There's two bills, two substitutes.
Okay, hold on. Are we on, which bill are we on?
1169 first.
Let's do 1169 first.
Okay. All right.
So is there anyone here to testify on 1169? Mindy? No?
I'm just now reading it.
Okay.
Yes. JLARC we're basically trying to tailor this to the recommendations of the JLARC study. Drew is here on that.
Okay,
and as well as others.
I can explain 1169.
Okay, well, I think the center just explained it. I mean,
Well, Mr. Chairman, I
Yeah,
have a
go ahead,
question.
Senator Donovan.
What is the outcome we seek to achieve with these changes?
Mr. Chairman, Senator, so 1169, what that would do is actually, instead of having the code say that the department may do performance monitoring, it's an expectation that they shall do performance monitoring. That's the key thing in this bill. And so that's a key thing and then setting up
delineates the
expectations.
standards. Okay.
Currently,
All
it's permissive, and we found that there's a lack of meaningful accountability.
Okay.
And that extends it to the enforcement of the contract provisions.
Right.
So that's as they do that.
Are there more questions?
Okay, Mindy, where are you on this?
Mr. Chairman, members of the subcommittee, I'm Mindy Carlin, Executive Director of the Virginia Association of Community-Based Providers, so we represent the providers in the private sector that are delivering publicly funded service. I haven't read the bills, so I'm not opposed to the bills at all. I think it's really important, and we're at a critical point in time where it's important that we be clear on the role and the mission of the CSBs, particularly relative to the private sector providers who are delivering so many of the services as well. So I think to the extent these bills, and I know that's the aim, advances that and allows us to take a step back and really evaluate that and inject a greater level of accountability across the board. It's a positive thing. So.
Mr. Chairman, one question.
Yes, go ahead, Senator Donovan.
What % of the services do the community-based private providers?
Thank you, Mr. Chair, members of the subcommittee. At this point, for the Medicaid-funded behavioral health services, private sector providers are actually delivering between 80 and 90% of all of those services.
Wow.
And so I know JLARC, in their report, didn't differentiate between private sector providers of publicly funded services versus just private providers of commercial insurance. And so I do think there's a very important distinction with respect to how we deliver Medicaid-funded, publicly funded services in Virginia. Thank you, Mr. Chair.
Mr. Chairman, in ways it ties back into our conversation earlier on a whole different subject in that if we're going to have the expectations of getting these services delivered uniformly statewide, we've got to put up the money to support it, particularly for these private providers, so that they can employ enough people to do it and get the services accomplished, as well as through the CSBs themselves.
Okay.
So we're taking that action.
I'm living in a binary world here. Are people opposed to this bill? Because I feel like there's a lot of talk, but we got to
Move to recommend reporting.
All right, so I have a motion and a second to recommend reporting. All in favor, say aye.
Aye.
Sasslaw Barker, aye. Okay, so that's 1169.
All right. And again, the 1465 is similar.
Move to substitute, Mr. Chairman.
Okay, second motion to substitute. All in favor, say aye.
Aye.
All right, thank you, Mr. Chairman. And similar in terms of goals, it's based on putting in place recommendations of the JLARC study. And, obviously, JLARC is represented here today, and they have talking points about why they've been a part of the negotiations with the Department of Behavioral Health in terms of coming to a consensus. This is the one that, as I mentioned earlier, as I was talking broadly, contains the clear definitions of what is expected.
Okay.
In terms of the mission of the CSBs. And, there was broad consensus that these directives would be helpful. And again, there's certain provisions where there's a delayed enactment because they have to have time to comport to the requirements there, the rearrangements.
Okay.
Okay. Anyone want to testify on 1465? It looks like more just...
Thumbs up. Opposed.
Anyone here to testify for or against Senate Bill 1465? This has to do with the community service boards.
Move to recommend reporting.
Okay, we have a motion and a second to recommend reporting. All in favor, say aye.
Aye.
Okay.
All right.
70.
Thank you, Mr. Chairman.
Is that everything?
No, we've got one more here, and
Okay.
this one is a little different direction. This didn't develop from a recommendation of JLARC. This came about as...
Move the substitute.
Yes, a substitute again.
Okay.
Second.
Okay, second. All in favor, say aye.
Aye.
Okay.
Substitute
All right.
for us.
Just a little background here. We have set up a behavioral health commission, hired an executive director, and Natalie, I believe, is probably in the room. Sarah is here.
Oh, no.
Yeah, Sarah, come up here, Sarah. Sarah's been my lifeline for knowing stuff for a long time, and as she's helped a lot of us put some meaningful legislation on the books over the years. Yeah, and at any rate, here's the brief explanation. At one point, we decided through negotiations maybe several years ago that we would create a division within JLARC that would deal with behavioral health issues, mental health, and so functioning there, they had all the power of JLARC. As we established the Behavioral Health Commission and hired an executive director and then hired Sarah to be a part of that activity and a couple other staff people, we are basically within the Behavioral Health Commission performing that function of investigating studies and all of that JLARC would have been doing. In that vein, there's a requirement embodied in Senate Bill 1170 that the Behavioral Health Commission have that same authority in terms of requesting and receiving information, just as JLARC would. Now, that was a sticking point in our conversation here with the administration, but essentially, we're not creating anything new. We're not, as it's structured now, which Sarah can explain, it doesn't divulge individual data, it's aggregated data. So I would like Sarah maybe to explain why this is important for the Behavioral Health Commission to have this authority.
Okay, go ahead.
Okay. Good evening, Sarah Stanton with the Behavioral Health Commission. This bill does two things for the Commission. The first longer piece is that it creates a FOIA exception that will protect information that the Commission obtains during the course of an investigation or a study. Protects that information during the time period that the study is ongoing, and then when the study has been completed, protects that information from release in any way that would identify the person that provided data or information to the Commission. It can be released in a redacted form, but is intended to make sure that the Commission can get the information and data it needs to conduct its studies consistent with our statutes. The other thing that the bill does, the shorter piece, but the piece we've done work on in this substitute, begins on line 111. It's pretty different than what you had in the introduced bill. The changes to this section make clear that the Commission may request records, including data and information that we require in the performance of our duties, so it does have to be related to our statutory charge, and that every department, division, board, et cetera, that you see listed there shall provide those records and data and information to the fullest extent possible and except as prohibited by law. So it does not require anybody to release anything that they are currently statutorily prohibited from disclosing to us as we're doing a study. It also, again, clarifies that, as is the current law, we will continue to receive cooperation and assistance in the performance of our duties from agencies of the Commonwealth and those you see there.
You don't need to read every line. Okay. Okay, this basically has to do with the power of the Behavioral Health Commission, that they can request records as part of their mission, and they get an exemption from FOIA for those health records that they recover. Okay? Anyone for or against this bill?
Mr. Chairman, I have a question.
Go ahead.
What
Senator
are you
Donovan.
statutorily authorized to investigate?
Mr. Chair, Senator Donovan, we are statutorily authorized to investigate behavioral health system, behavioral health services, and changes there too, with the goal of making sure that the Commonwealth's behavioral health service system is effective, efficient, and that it provides the services that individuals need. So focused primarily on public delivery of services, both looking at what we're currently doing and weighing in on any proposed changes.
Mr. Chairman,
Yes, Senator Donovan.
how does that intersect or overlap with OSIG?
That is a good question. I'm not sure what our overlap would be with the OSIG.
They
have
investigate.
They do. I'm sorry, I don't have a great answer for that. I think there'll be a more specific investigation of specific issues, and we're charged with a broader structural.
My layman's take on that would be that OSIG is for looking to make sure there are not problems that would be perhaps even legal problems. But whereas we're looking for information to base our activities on, how we improve programs, to build programs, to correct program deficiencies in terms of providing services. So to do that, we want to know details about people that are under mental health institutions that are being serviced in community services in detail, so that we can follow up on the problems that exist and try to figure out a better way to do it.
Okay. We got to move this along, guys, because we still got a lot to go. So I need a motion one way or the other.
I am still thinking on it.
Okay, why, I mean, I don't really have a strong opinion on this bill, so Suderline, where are you on this?
I don't have a strong opinion either. I'm happy. Mr. Chairman,
Yeah, go ahead.
to get the ball going, I'll move that we recommend report with the understanding that we're going to have our ears open to see if people present stronger opinions or other details to us between now and Thursday.
Yeah.
But at least to put it in a better posture. And then if we don't do it, we don't do it. But with that, I recommend we report.
Okay. I got to recommend Sasslaw seconds. I'm going to abstain. You know, what, we're getting some of these substantive bills and no one's testifying one way or the other, and I am not a subject matter expert, okay? So if y'all don't have an opinion, you know, we're gonna move slowly.
And I'm going to abstain just because I
Okay.
would just want to ask a couple of questions. Yeah, I
Okay,
want
all
to
right.
sort it out.
So, all in favor say aye.
Aye.
Sasslaw, Barker say aye, and Peterson and Dunham abstain. Okay, there you go.
There you go.
You're on your way.
Thank you, Chairman. Appreciate it.
Amanda.
Who we got left on there? Morrissey,
I
Newman.
got Morrissey and Newman.
Yeah.
I think Favola's already gone.
Mm-hmm.
Why don't you start low and go high? And let me just say, one of your bills I think we substantively dealt with when we dealt with Mark Peake's bill, that was 791.
791, the save that?
Yes. That's, I mean, you can bring it up, but I think we've kind of already dealt with this.
Okay, I'm sorry, I was unaware of that.
No, that's no worries. So let's go with 791.
Okay, 791, and this is the Save Adolescents from Experimentation Act. And the cut to the chase version is, this only applies to minors, and the bill prohibits gender transition procedures. And again, we're just talking about minors here.
Okay.
And prohibits the use of public funds for gender transition procedures, and establishment enforcement procedures for violation of the SAFE Act, but this is geared toward minors. And 80 to 90% of minors presenting with gender dysphoria who are supported by their biological realities come to embrace their biological gender by adulthood and outgrow their psychological gender dysphoria.
Okay. Let me just stop, because we had a pretty robust hearing on this exact same issue.
Really? Okay.
Yeah, and I'm
I
sorry you
should've been
weren't
here
here.
earlier.
And we've got a lot to do. So if you're in favor of 791, stand up. If you're opposed to it, stand up. Stand up. I see y'all. Okay, I think it's fair to say, and I don't want to disrespect anybody's time, I think we can just go ahead and have a vote on this, because, and Amanda, no disrespect to you,
Nope,
but we
that's
had a full
good.
hearing. on
Yeah,
this.
I got 3 more to go.
Okay, so.
And
yeah.
the decision was that parental rights.
Yeah, and we talked about that, it's parental rights. So I'll move to PBI, Sasslaw will second. All in favor say aye.
Aye.
Aye. Sasslaw, Barker, aye.
All right, so what I would like to do next.
So that bill is, 791 is defeated, so if you're here for 791, you're free to go.
There you go.
You got it.
So what I would like to do, I've got 2 bills that are very similar in nature, Senate Bill 792 and 833. If I could just roll Senate Bill 833 into 792.
And Mr.
Okay,
Chairman,
yep.
I'll just point out that earlier we rolled Reeves' bill,
Yeah,
I
we
can't
rolled
remember the
Reeves'
number,
bill into your
into your 792.
Great.
So just so you know, that's on there too.
Sweet.
Yeah.
Okay,
So
good.
we're going to roll together 792 and 833. All in favor say aye.
Aye.
Which one's in the which bill?
Oh, okay.
It all goes
We'll
in.
roll into the lower, so 833 rolls into 792.
Very good.
Okay, what are we doing here?
All right, so, of course, I moved to report this bill, but no one should be mandated to get a toxic jab or be discriminated against because they will not get a jab. No child should be mandated to receive the jab, and all religious, medical, and philosophical exemptions should be honored, even in a state of emergency. COVID vaccines do not prevent you from getting sick with COVID, passing COVID to others, or dying from COVID. COVID shots are toxic, and more injuries reported from the COVID injuries in their short deployment in the last 2 years than all other vaccines over 30 years combined, and that's according to vaccine safety databases. The COVID shots are experimental gene therapies approved for use under emergency use authorization, not traditional vaccines. They have barely been tested, especially in children. We don't know what the COVID shots do to the body over time. Kids are most immune to COVID, and 99.995% recover easily if infected. While other countries and some U.S. states are recommending against giving shots to healthy young people, Virginia's Department of Health is fast-tracking regulatory action to consider adding them to the required childhood schedule of immunizations. The CDC and FDA recommend the shots but do not tell the public about the catastrophic levels of vaccine injuries and deaths being reported. Emerging data shows that COVID shots appear to negatively affect fertility and increase cancer risk. Risk of COVID vaccination clearly outweigh benefits in young and healthy people. No studies exist that prove COVID vaccines are safe in the long term. Requiring vaccination without providing accurate information about risk, benefits, or alternative options violates the Nuremberg Code, parental rights, and the fundamental human right of bodily autonomy. Use or threat of coercion, retaliation, or social restriction to promote or achieve vaccination violates the Nuremberg Code. Dr. Marek is a doctor, Dr. Paul Marek. He is an accomplished physician who I've worked with on this legislation, along with Dr. Robert Malone, who is one of the original inventors of the vaccine. Dr. Marek has special knowledge in a diverse set of medical fields with special training in internal medicines, critical care, neurocritical care, pharmacology, anesthesia, nutrition, and the list goes on. He knows his stuff. But here's the point, and I'm going to leave it with the executive summary here.
All right.
The vaccine kills 2 per 1,000. It's killed 30 per 1,000 of 65 and older. It's killed more people than the COVID virus by at least 5 to 1. 5 to 10% of our healthiest soldiers have been disabled by this vaccine. An average 8% of recipients of these vaccines have suffered a serious adverse event. Vaccinations during the first, and these are all, that's why I gave you the information on Dr. Merrick. These are
we
his
really
stats.
need to wrap this up because I got lots of bills left to go.
But this is probably my most important bill this whole year.
You know what? And I
I'm so
appreciate that,
concerned.
Amanda. And I mean, I think I can summarize what you're doing here.
Right.
And that effectively what you're doing is you're creating a protected class of people that refuse or don't take the COVID vaccine such that they cannot be discriminated against.
Right, because they are. Even now, even in Virginia.
All right.
They're losing jobs, they're losing educational opportunities because there are still yet in Virginia private employers who mandate these jabs.
Well, that's what I was about to say, that these are, forget they're private.
But
So,
they haven't proved the
let me give you an
effectiveness of the vaccine. If it was proven like a childhood vaccine, yes.
Enough. And let me tell you a private employer I'm very familiar with, myself.
Me too.
And when I never closed during COVID-19, we were open, and I had all my employees go and get vaccinated. That was my choice as their boss. And I basically said, if you don't get vaccinated and you get sick, you may not be coming back, okay? Because I can't afford it. And so they did. Now, I didn't fire anybody or anything like that, but I basically made it clear that I expected all my employees to do that. Now, that may or may not have been a good decision. I also make all my employees take a bar exam, at least the attorneys. But the point being is that private employers oftentimes will put restrictions or put tests on their employees that may not seem rational to you, but again, other than sort of historically discriminated against groups, by and large, we allow employers to make those decisions.
Mr. Chairman, I would argue if the vaccine worked, yes. But what we're seeing, I've spent a lot of time on this bill for almost 3 years, working with the most incredible doctors and experts on this, like even the founders of the vaccine.
Okay.
And they even got the vaccine, and they're telling people, they're recommending do not get the vaccine because of the deaths. outweighing the benefits of the actual
Right.
vaccine. So we as a private employer, and my husband and I are private employers as well,
Right.
we do not recommend getting the vaccine.
Let's do this, because like I said, we could spend all day just debating this issue. If you have a strong opinion, come forward and state it in about 10 seconds.
Again, Dr. Barbara Zuther, on behalf of the Virginia Medical Freedom Alliance, we strongly support
Okay.
everything that Senator Chase said. It was brilliantly presented, and it doesn't trump the God-given natural right to bodily autonomy of every single individual to choose what they expose their body to internally, externally.
Okay, and I get it. I got 7 o'clock basketball practice, so I'm trying to move this thing along, but I appreciate it. Thank you. Yes.
5 seconds.
Yes, sir.
Recently, I was at a huge meeting with Dr. Malone, Dr. Merrick, and the final statement Dr. Malone made to a large group was,
Yeah.
if you're 40 or under, never get the vax. You stand a better chance of getting COVID if you got to take the vax.
Okay, thank you, sir. Yes, ma'am.
Ariel McAloon from Fairfax County. We are opposing the bill.
Okay, Fairfax County government? Yes. Okay, all right. Anyone else have an opinion on this bill? I know we probably all do, but I think listen, here's my position. Amanda, I appreciate your bringing this bill. I mean,
It's a good bill.
well, and we have to make tough choices. And I'm sympathetic with a lot of the things you're saying. I do think as a private employer, we get discretion to make decisions. And if you say my employees have to be vaccinated, then maybe you run a type of business where you feel that's important. And I just feel at this point I'm not ready to support this bill, so I'm going to move to PBI. And I think Barker's going to second my motion. So that's where we are. I'm invite further discussion by the panel.
Yeah.
Go ahead,
I'll
Senator
defer to
Superline.
Senator Donovan.
Go ahead, Senator Donovan.
Thank you, Mr. Chairman. I was trying to make sure I read all of the provisions and look at all the roll-ins. Does this apply only to children, or does this apply to adults and everybody?
This applies to everybody, adults and everybody.
Thank you, Mr. Chairman. That was my question.
Okay. There's everybody.
All right. Mr.
Senator Suderland.
Chairman, speaking briefly to the motion, I don't think this bill would be ready to report as it is. I think it tries to do a lot of things in several different places, which is generally not the way I appreciate legislating. And I think that's where we get on the wrong track. I think there's several components of this that are very good regarding making sure that the Commonwealth of Virginia is not requiring it.
That may be different. That may be a different
But
issue.
then it enters into other places on private enterprise, and it's not a question of the vaccines or any issue if it's a good idea or not a good idea when it comes to private employment. It becomes an issue of the private enterprise and what they're able to do there. And we could say, we think it's ridiculous that you require X or Y, but that's what Senator Peterson's law practice required. That might be what the real estate company where I work at is required. So I'm going to vote against PBI, but if the motion were to report, just know that I don't think that the Senate could pass this as the way that it's structured, even if the Senate were composed differently. I think there's issues with how this is put together.
I would welcome the opportunity to educate and even speak to folks at another time.
Senator Chase, like I said, I feel like I've been educated on this issue as much as I can be. I'm not, we may or may not be back here next year. I just don't feel at this point to mimic Senator Suderline. The impact on private enterprise, I think, is a little too much for me. So anyways, we have a motion and a second to pass bill by indefinitely. All in favor say aye. Aye. Sasslaw and Barker, aye. Donovan, aye.
And on PBI, I'm a no.
Okay. What else you got?
All right, so Senate Bill 1315 is a bill you're going to love because it has to do with masks.
Oh, my gosh. All right.
So we took care of our kids in public schools and eliminating the requirement to wear masks. And generally speaking, we don't wear masks in general. And I don't know if you all saw this or not because we've been so busy during session, but President Biden just declared on January 30th, that was yesterday, declared that COVID pandemic to be over. It's effective May 11th. That's the day that COVID is going to officially be over. And that's according to the New York Post, CNN. It's public knowledge. The pandemic is going to be over. So what can we do about masks? I think it's time to get rid of the mask. I actually, I presented all the 32 studies and everything talking about how masks actually make you sick during the last session. I've got a number of studies which I won't go through today, but I will tell you the University of Wisconsin is concerned about those fibers that are in your mask that actually get in your lungs. I've got a number, the University of Copenhagen agrees with that. They had over 6,000 participants that were involved in this, and they found issues with the microplastics that you inhale and actually end up depositing in your lungs and all the issues therein. So to cut to the chase, even if you look on a box of paper COVID-19 mask, what does it say by the manufacturer? It says does not protect against viral infections. So, Mr. Chairman, I would ask the body, the president has already said May 11th, where COVID is gone, we're going to be getting rid of masks. This is going to go to effect in July 1.
Right.
It's time to get rid of the mask.
Okay. Let me, and I was in the middle of the mask wars last year.
Yes.
I was, and I don't regret a moment of it. It's one of my...
Let's do it for the adults,
Well,
too.
hold on. The children were different because of the way 1303 was structured. It was basically we gave them leeway, and then we had to take it back. And like I said, that's how it is. Localities right now don't have the ability to enforce a mask mandate. Okay, some of them asked for it. We didn't give it to them. Here's where I stand personally. I don't want to deal with masks this year. Okay, I look at this bill, and I'm the same way. I don't think it's right for government to require anyone to wear a mask or a private employer. But at this point, I just don't want to deal with this fight again. Okay, I spent a year fighting this. I'm over with it. So I appreciate, again, you're bringing this bill up. We had so much testimony on this over the last 2 years. I don't need any more testimony. I've heard it all. So I don't know if there's a lay the bill on the table motion, but I just feel like at this point, I'd just like to give this issue a rest for a year. And I'm not wearing a mask, okay, and neither are you.
Me either. I haven't.
It's not a clear and present danger to us right now. No.
Mr. Chairman, if I may, my issue is I just don't like the government telling businesses and private industry what they have to do. And you're talking about private schools who we do not govern and private businesses that we do not govern. Let them make people not want to go in there because they're wearing masks. But if we let the state start getting in our business, we are on a treacherous, slippery slope, and that's why I cannot support this bill.
All right.
Mr. Chairman?
Yes, Senator Suderline.
So I think this is probably the subcommittee and probably the entire General Assembly, even compared to the other body, its current composition was the most opposed to mask mandates in
No doubt.
public schools.
Yeah, I don't doubt that.
Between just from the chairman to this end of the table. Well, and that he just saw it differently, and that's quite all right. That's what we're here to do, is discuss our different views and what can be best for the Commonwealth. But this bill, which is shorter than the other one, but it seeks to do so many different things. Last year we were directly dealing with public education in the Commonwealth. This has a section dealing with private schools, which Senator Donovan alluded to. Parental choice, the parents have chosen to send their child to the private school. If the private school chooses to have that policy, the parent can decide to say, well, you were there Friday, you're not going back Monday. I just don't see why we dictate to the private school that. I mean, my kids go to public school in general, and but if I were choosing to send them to a private school, I should be allowed to send them to the private school of my choosing on that. And also this provision that says employers can't do it. So does that mean that the hospitals couldn't do it?
That was another issue, that you might have healthcare providers.
Mr. Chairman, just finally,
Yeah.
I think it's just a difference in philosophy of who believes the mask and the vaccines are effective and who believes they're not.
No,
You
just
know,
if I could
I
continue
mean-
real quick on that point. long before I'd ever heard of COVID-19 or coronavirus or anything like that, when each of my children was born, I was asked to wear a mask there, and I didn't like it, but I said, that's all right. I understand that I'm in your hospital, and I want to be present when this happens, and my wife really wants me to be there, so that's the way it's going to be. I just don't think, I think the way this bill is written, hospitals couldn't even tell surgeons that they have to wear the mask, and I think that they should wear masks. And I think the hospitals ought to be able to say that.
All right, guys, I don't want to beat this into the
Second.
ground, but we have got to get this moving. All right, I have a motion, PBI, I have a second. All in favor, say aye. Aye. Okay. Any opposed, no. All right,
Thank you.
Amanda, thank you.
Yes.
All right, Joe, you're next, and then Jennifer, I'll get to you. I'm
And
sorry.
then I'll text Newman whenever you're ready. Newman's
Yes,
still waiting.
okay.
You tell me.
And we're moving fast, guys, so, let's keep it rapid fire here.
Thank you, Mr. Chair, members of the committee. The first thing I'd like to do is move the amendment that you all have in front of you.
Second. So
Very,
moved.
I don't want to say inconsequential, very minor amendment dealing with consultation. Okay, you need to.
Go ahead, Joe. Yes,
You need
sir.
to, I moved the amendment.
I moved it. Moved the
Move
amendment.
second. All in favor, say aye. Aye. The amendment's in front of us. Yes, what do we have?
All right. SB 1487, during last year's session, I introduced SB 129, which would have allowed for alkaline hydrolysis in the Commonwealth, another way of cremating bodies. It uses an alkaline hydrolysis, all right, as opposed to cremation and the normal burying that many of us do underground.
Where do you get these ideas?
Okay.
So what came with that work group?
Yes, thank you. Thank you for that. It was turned into a work group. The work group came up with 3 recommendations. Those recommendations are part of this bill. All right? That's it. If you want me to get into the weeds regarding the recommendations, I'll do it quickly. I know time is precious. The first recommendation was that alkaline hydrolysis is an acceptable means of final disposition. Recommendation 2, the definition of alkaline hydrolysis is a separate and distinct one within the code. And third, a creation of a regulatory structure for alkaline hydrolysis that needs to be created that appropriately reflects these differences. I believe there were the SBA had all the stakeholders there. I believe there's peace in the valley. I will say this for those people that are environmentally sensitive: it does not burn any fossil fuels.
Okay.
It does not emit greenhouse gases, and it uses 90% less energy than flame-based cremation. Lastly, it produces SB 1487 establishes a registration process for funeral homes. Not a earth-shattering bill. It came from a constituent funeral director in one of my jurisdictions, Mr. Chair.
Shocked to hear that. Okay.
Anyone
opposed?
Very good. Anyone opposed this good bill? Yes, come forward, please.
Harris Mitchell with the Virginia Catholic Conference. We did oppose the legislation last year as well, and in our view, disposing of human remains via alkaline hydrolysis, which the liquid remains frequently are disposed of in the sewer system. Yes?
Will we all be resurrected on the last day?
I certainly hope so. I hope
And
you'll be
will
there
this
with me.
prevent us from being?
I can't speak to that.
All right.
However,
When
we
you
do
have an answer on that, I want you to let me know.
Mr.
Okay.
Chairman, I do have something too. I have something to.
Yes, Senator Donovan.
Yep. This is from a constituent who is involved in the work group.
Okay.
And they had considerable input from the Department of Health and DEQ about local permitting and inspection of these units by the local wastewater management authorities, because the effluent discharge we were not sure they would have the ability to process this in the wastewater facilities. They were concerned that the units might be inappropriate for septic systems if they're in rural areas. So there's not peace in the valley on.
Okay. So separate and apart from the theological issues, which are significant, what about the environmental issues? Senator Suderline.
Obviously, was there anything more that was missed from the Catholic conference on that? I just don't want you to be shortchanged.
They don't like it.
The dignity of the deceased and the remains of the deceased to be a strong public policy, and that we do not consider
Okay, thank you. I just wanted to make sure we heard the concern there. Thanks.
I think there's other people want to speak on this. Angie? No? In support or opposed? Come forward in support. So Catholic Conference was opposed. I don't know, we got out of sequence. All right, support. Go ahead, Angie.
Angie Busick on behalf of the Virginia Funeral Directors Association. Senator Morrissey asked you to move an amendment, which made us very comfortable with this. The wrap that the board managed throughout the end of last year looked at all of these things with regard to the effluent. The recommendation was to allow the wastewater facilities to have a hand in the permitting to make sure that they could manage it. We're confident that the work that they did, it is a good precursor to the regulations that will ultimately come about.
Okay.
So that's what
That's
this
the amendment,
is.
yes.
Okay, I've got
That was a result of, was much
Okay.
better summarized than what I did.
Bo?
Bo Keeney, Independent Funeral Homes of Virginia. I'll align my comments with Angie. We appreciated the work that everybody put in the work group, and the amendment that Senator Morrissey brought forth should grab those environmental concerns, the wastewater concerns, and make sure that that's handled during the regulatory process.
Okay, just for the folks that are out there, Scott?
Services Corporation International dittoed all of that.
Okay, it just says that the amendment says that the board shall consult with DEQ, the Department of Health, and representatives of wastewater treatment facilities, basically to promote regulations to deal with alkaline hydrolysis and any sort of environmental effects. Okay, I think that's helpful. All right, anybody else? Any questions from the panel? Okay. I got a live one. I'm going to move to report. Is there a second? Second from Barker. All right. All in favor, say aye. Aye, and that notice hydrolysis.
I'm going to abstain just so I can check.
Stanislaw
with
should
my
probably abstain, but I'm going to vote him
Yeah.
anyway.
Thank you, Mr. Chair.
Do we need Norman, or is he not doing this?
All right, thank you, Joe. All right, Jennifer. Yeah, we're striking. What number do you have?
1327. You all saw last year and reported to finance. No? I don't think so.
Okay, and I think we've had some people been waiting for this, and thank you for your patience.
They have.
Okay.
This bill would create a comprehensive health coverage option for low-income children regardless of their immigration status. We refer to this as the Cover All Kids program. This would open a path to healthcare coverage for roughly 13,000 children in Virginia who are uninsured. About 9,000 are uninsured and 4,000 are underinsured. 9 states and D.C. have done something similar. And basically, they are not allowed coverage under Medicaid, CHIP, or the Affordable Care Act because of their documentation status, but as they are uninsured, we end up paying for the cost of their care when they don't get preventative services or when they show up to the emergency room, and this bill would help to ensure that children at least are covered.
All right, so let me see if I can cut to the chase here. Basically, this would. All right, let me see if I can summarize. This would allow children of undocumented families to basically be enrolled in FAMOUS, or is it still called? No.
No. Well, it would create a state program. So FAMOUS is a joint federal state program.
Well,
They
it's
are not
funded by the feds, but it's a state program. It's part of DMAS.
This is a state program
But this is funded through DMAS.
and state funds, yes.
Right. So I guess my initial question is, are we going to get federal matching money for this?
No, I have a budget amendment in that would fund this.
How much?
14.5 million, I think.
14.5 million. Okay. Does anyone on staff know, I mean, would we qualify for any federal matching funds from Medicaid, from CNS? No. So we would do this on our own. Okay. All right, we have some witnesses. Please come forward.
Freddie Mejia from the Commonwealth Institute, just to answer the question around matching. There are some states that carve out emergency Medicaid services
Right.
that right now, so if that were the case here in Virginia, then for those services, you would be able to draw down federal funds, but
For the emergency services.
For the emergency service, correct.
Okay.
So that's, I just wanted to speak to that question.
Okay, yes, come on forward if you're in favor.
Christian Martinez, the Advocacy Specialist at CASA. We thank the patron for bringing up this bill each year, and we're greatly thankful for her bringing it up. We do have some folks from Prince William County that do want to speak, so I'll keep my remarks brief.
Yeah.
But we strongly support this bill. Thank you.
Okay, I know you all have been here a long time, and thank you, but just briefly state your name and where you're from.
I'm going to make this brief. My name is Francisco. I'm from Prince William County, Northern Virginia, and I support this bill.
Okay.
Reason being is because I grew up here as an immigrant. As you see my condition, I'm albino. I couldn't get enough help from the Department of Health to help fix my eyesight, be able to drive, or just be able to do normal things. I don't drive until this age. I'm 31 because there hasn't been enough funding. Situations like mine cost a lot of money, like glasses and things like that. It costs about $10,000, and other surgeries cost $20,000 to $30,000. Nobody has that money, so I'm here to support obviously for under the age of 19, regardless of ethnicity and background.
Okay. Thank you for being here. Okay. Next up, folks, and let's make it quick. I know you've been here a while.
My name is Rosie. I've been a member in CASA for 2 years. I was born in Mexico. I live in Chesterfield, Virginia. I appreciate the opportunity you gave us to stand in front of you and be the spoken person for the entire state. Health is very important for us. More than the privilege is necessary for all. For me and my family, having medical assistance of health insurance much more favorable for everyone, regardless of immigration status. It would be excellent in our lives. Children deserve to have affordable insurance with the coverage program without having to suffer financially. Same for young people and adults without immigration status can have paid sick days as well. More in these difficult times that we have been victims of pandemic. That's why we ask for your support so you guys can vote yes to the medical assistance.
Got it. Thank you so much.
You're welcome.
Okay. Anyone else? Just tell us your name, where you're from. That's good. Betsy, where are you a student? Where? Manchester High School in Chesterfield. Okay.
My name is Melissa. I'm a student and I support the bill.
Great. Thank you, Melissa.
Good evening, Mr. Chairman and members of the committee. My name is Monica Sarmiento. I'm the Executive Director for the Virginia Coalition for Immigrant Rights. BASIR and its 45-member organizations fully support this bill. Virginia is the 10th largest immigrant population in the United States. We need a healthy future for our children and a healthy future for Virginia. Thank you.
Okay, thank you.
Good evening, Emily Moore with Voices for Virginia's Children. We also strongly support this bill and believe that the 13,000 children that this could help should not wait another day for adequate health care and mental health care services. Thank you.
Okay.
Good evening, Sheila Herlihy with the Virginia Interfaith Center for Public Policy. We also support the bill and align our comments with those who came before.
Great. Thank you, Sheila.
Emily Hardy with Virginia Poverty Law Center. We just wanted to point out that a lot of these kids are already getting uncompensated care at emergency departments, schools, and clinics. And the importance of early intervention provides better care long-term, costs less long-term. So we support this one.
Got it. Thank you.
Abby Phillips, Legal Aid Justice Center. We support this bill.
Thank you.
Lauren Schmidt, Virginia Chapter of the American Academy of Pediatrics. We support this bill.
And you heard from me, Freddie Mejia at the Commonwealth Institute, and we support the bill.
Great. Thank you. Okay. Anyone in opposition to the bill? Okay. I think this is good. I think there's some questions about the money. And like I said, whether or not we can pull down federal funds and how this would be structured through DMAS. But Jennifer, I think this sounds like a great idea. So do you have anything else you want to add?
No, just last year you all reported it and referred to finance, and I asked you to do the same.
Okay. I think that makes sense. I will make the motion to report, and Barker will second me to go to finance. All in favor, call the roll. Or all in favor, say aye.
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 Just leave him off. I don't know.
What do you want, suit or line? What?
Just-
Abstain him, I
Yeah.
think. Probably
Just-
makes sense.
Yeah, just don't vote.
Just don't vote him. Okay. Thank you.
Yeah.
Okay. Who else other than, I know I've got a bill left. Anybody else?
Newman.
Steve,
Poor
I'm
Newman.
sorry. All right.
Hello, Mr. Chairman.
Newman, okay. All right.
Okay.
Oh, God. All right.
I got a long version and a really long version.
Okay.
There's an amendment.
Move the amendment.
Move the second. All in favor, say aye. Aye. The amendment's in front of us.
Mr. Chairman.
Yes, sir.
You guys have been very helpful, George, Janet, others, to help us fix this Central Virginia Training Center issue. We defeased the bonds. Cost a lot of money. It's $19 million in the end. We still have a negative value on the property because there's 90 buildings and we don't know what to do. I hope Senate Finance is able to get us $5 or $6 million from the money that we didn't spend on defeasement. We'll see. The only other way that we can think of to bring that up to from negative value is to take those 4 buildings that were fantastic. I mean, they were brand new buildings at the training center, and try to find a way to repurpose those. And the way to repurpose those, the best we've come up with, is to put COPN beds in there for nursing homes and long-term care. I don't know if this is the perfect way to do it. What I'd ask the group to do is if we can get this bill up to finance, and maybe smart people like George can figure out how to do it. That really is kind of where I am. Scott Johnson, you've got the amendment, and basically it said, just make sure you explain this is a really special deal so it never becomes a Christmas tree. We did this years ago a few times when I was chairman of this committee, but I agree with that, and so we've adopted, or we have the amendment available, I guess. Okay.
Okay. All right. We adopted the amendment, and okay. I guess what you're asking us to do is report and refer this to finance. That's right. And we'll have to figure it out from there.
I'm happy to move that.
Okay. We have a motion and a second to report and refer to finance. All in favor, say aye.
Aye.
Aye. Okay. I've got a bill 953. And then what else is left? Does anyone else?
Barker.
Barker, what do you got?
Nursing home staffing attendants.
Okay, why don't you go first and I'll do mine. Okay, what number do you got?
1339.
Okay, we've got 1339. I've got a substitute.
We got a substitute.
Motion and a second to adopt the
Yep.
substitute. All in favor, say aye.
Aye.
All right.
I look forward to reading.
What do you got?
Thank you.
Okay.
All right, what this does is, what this does is it establishes standards for care within nursing home facilities across the Commonwealth, and it's adjusted for the needs of each individual there to be able to has the flexibility to be able to make sure that the target we're shooting at is the right one for the people that are in each of the facilities across the Commonwealth. There had been a year-long study in the Joint Commission on Healthcare in 2021, and there was legislation that I had introduced in 2022, but that never got heard in subcommittee, and there was a last-minute action that basically resulted in that not moving forward. But the nursing home industry itself came forward this past year, and worked on a lot of issues, and has put together with my providing some input into this as to sort of how we get some flexibility to be able to sort of phase it in over a period of time to make sure that we have the funding that is there in the Medicaid program for making sure that we could provide the services within each of the nursing homes across the Commonwealth, and then with a sort of delayed enactment of having everything in place over a couple of year period that would be helpful because right now, as I'm sure most people are aware, there are staffing shortages across the Commonwealth for long-term care services and many other medical services. And so particularly in nursing home and assisted living, there are some real shortages there. So what we need to do is to make sure that we give the facilities that are really struggling to and trying to do the right thing and have enough staff members there to give them time to be able to hire enough people there to address the issues that are the challenges for getting people to provide the nursing and support services in the nursing homes themselves. So that, and also to be able to make sure that we had enough funding to be able to provide, to cover that cost. So that's what this bill has here, and I think it can go a long ways to helping make sure that people are adequately cared for in the, right now in nursing home facilities, and then to the extent that it also spills over into assisted living, which we also will get some benefits there as well, I'm sure.
Okay. All right, any questions for the patron? All right, is anyone opposed to this staffing standards bill?
Mr. Chair, I'm not opposed.
Okay.
And I'm playing basketball too, so I promise I'll
Okay,
be
yeah, very quick. Yeah, we need
Jerry
to.
Chalpy with AARP Virginia and also representing the Virginia Voices for Nursing Home Residents Coalition.
Yeah.
The substitute that you have before you, I think, is a significant improvement over the original language.
Okay.
A lot of work has been done on the House side of this language,
Right.
and so I'm glad with the progress that we've made. I do want to voice that we still have concerns with the exemption language that's written into the bill. They're kind of broadly applicable, and we would like to see that
Chairman,
language.
can you just, when you say you have a concern, can you tell us where in the substitute it is, or at least the section?
Yeah, so the exemption section that you'll see in the legislation, there's three exemptions. There's an act of God exemption. There's one for, thank you.
Page 4 here.
Thank you, page 4, yeah. So the way those exemptions are drawn now is a little broad. That gives us some concerns, and what we would like to see is those moved after the corrective action plan process, so that facilities that fail to get to the staffing standards still have to put in a corrective action plan and kind of show that they're striving to improve their staffing, but then would be exempted from further administrative sanctions after that point. I know the industry has concerns that facility gets wiped out by a flood or a fire, that then they shouldn't have to submit a corrective action plan. And so we had a suggested amendment at one point that would insert language giving the commissioner the ability to, waive having to do a corrective action plan for extraordinary circumstances. So that's our concern with the legislation. But I will say that I'm really glad that this issue is being addressed. We think it's important, and we appreciate all the work that's been done on it to get it to this point.
Okay. All right, so I don't hear any, yes, ma'am.
Emily Hardy with Virginia Poverty Law Center, and we have the same concerns that Jared just brought up with the exemption section. So we just wanted to say we're not opposed to the bill either. That's just the one area that we think there still needs to be movement in.
Green or red?
I'm lost.
Today, do you want it advancing today or not?
We would like it to advance today. We just would like more work done in that
Okay.
section and to have it looked at.
Scott?
Mr. Chairman, on behalf of the Nursing Home Association, these objections have been raised multiple times on the other side. We've told them we've given the most we can do because of the workforce shortage. This substitute you've got in front of you, not that it matters, just passed down the hall 95-2, and it has the safeguards Senator Barker mentioned, so we would ask you to go forward.
Okay, all right. Well, listen, we're going to move this forward, okay? So I make a motion, staff's law seconds, to report this to full committee. All in favor, say aye.
Aye.
Staff's law, aye. Okay, so we're up 5-0. Okay, I think I've got the last bill, which is Senate Bill 953, which is a COPN bill. And basically, members of the committee, it has to do with effectively, and let me get my notes here. It's really a COPN modernization bill to reflect today's healthcare market. Allows expedited review for limited projects, which I believe are typical smaller scale diagnostics. They're listed out there, therapeutics, and just trying to get expedited review for CON for these, MRIs, diagnostics, things of that nature, so they become more prevalent in the community. People can have more access to them. I think these technologies have become so just ubiquitous that we want to get them, help them deploy in the community. So basically, it's just to list, it's psychiatric and substance abuse services, limited imaging service, a single specialty ambulatory surgical, and then one operating room to an existing ambulatory surgical. So I've got a witness. You want to come forward and just briefly describe?
Yes, Lauren Schmidt on behalf of the Virginia Orthopedic Society. We do support this bill. It's the exact same one from last year that was reported from the full committee at 8-7. Thank you.
Okay, so we passed this bill last year. Scott, you want to come up here and bash me? No? All right, no. Oh, somebody else will, okay. Yeah, go ahead, sure.
Mr. Chair, members of the committee, Brent Rawlings for the Virginia
Thank you,
Hospital
Brent.
Healthcare Association. And I'll just be brief. I think the things we want to point out here, appreciate the comments about streamlining and modernizing, and that was the work that we did in 2020. We put in place a lot of mechanisms, in particular the State Health Services Plan Task Force. One of the things that they were charged with was exactly this, looking at projects for which certificate of need review may not be appropriate, or projects for which expedited review would. And that was sort of the policy that was established then. Some of that work hasn't been done yet, obviously due to the COVID-19 pandemic. But these proposals that are being made, I would kind of push back a little bit on the surgery and imaging as being appropriate for expedited review. Typically, in expedited review, you have non-controversial projects, competitive projects, and that's not quite what we're looking at with these. Other criticisms of the bill, singling out a select class to get special treatment, a single specialty physician practice and practice over 3 years, those sorts of things, very narrowly tailored, which I understand are meant to be helpful, but it also has the effect of blocking other projects. The way that COPN works, you've got to demonstrate a certain amount of utilization, and this kind of dilutes that process. And so we just want to be very careful. And the last thing I'll just point out is to kind of put the pin in it from our perspective is just to point out the language.
You're not going to read all those notes.
No. This is the summary. Is just to point out, that this will have a financial impact. I think that's been acknowledged by the bill on hospitals. Looking at in the enactment clause, lines 179 through 81, putting together a work group to make recommendations for funding options to alleviate the risk of financial insolvency for public and private hospitals with fewer than 100 licensed beds in the event of a future public health emergency. Again, recognize that was meant to be helpful, but it also does acknowledge that this will have impacts on the healthcare system. Right. So I appreciate you.
Thank you, Brett. Very comprehensive. Okay. We did take this up last year. I think everyone kind of familiar with this issue, and I will move to report the bill. And we have a motion and a second to report the bill. All in favor say aye.
Aye. No.
Parker, no.
Yeah.
Where's Dick? Was he a
Dick is no.
Dick's a
Yeah.
no. Okay, 3-2, we're out.
Yeah.
Okay, wonderful. What?
Landslide.
We know.
All right, thanks, guys. It's 60%. 60% of the margin. Okay.
That's right.
All right, guys, good work. We got a lot done today.